Welcome back to our Health Beat special COVID-19 research. Last week, we sat down with the president of Research, Innovation, and World Clinics at Sanford Health, Dr. David Pierce, to see what research is being done here in South Dakota to learn more about COVID-19, how it spreads, and how we can develop a vaccine. Thank you for joining us, Dr. Pierce.
My pleasure.
So I'll start off by asking you, what research is Sanford Health working on concerning COVID-19?
Yeah, right from the get-go, obviously, a health system having a research capability has been tremendously important for our patients. So we currently have about 10 clinical trials up and running, which really, run the gamut of the whole disease. Never in the history of medicine have we been asked to define really the natural history of a disease in such a short period of time. So we have clinical trials now, which are an additional treatment option on top of standard of care, whether you're on a respirator, whether you're in the ICU, all the way going back in terms of the symptomology to a first diagnosis.
Talk to me about some of the challenges that you might be running into doing this research.
The challenges is really that, we're a very active research organization and we're very passionate about continuing our clinical trials and research in all areas. I mean, right now, the national average for patients with cancer to be on a clinical trial is about 3%, and we're very proud that 13% of our patients go on to these clinical trials. So maintaining the normal and taking on this additional responsibility has been the biggest challenge.
Have any research projects had to be put on hold because of COVID-19 research?
Right at the get-go, obviously, when we knew so little about COVID and we wanted to preserve PPE, it was very prudent for us to sort of slow some operations down as part of the health system, to pitch in and preserve PPE. But that was for a very short period of time, and we've gotten over that challenge now.
How has research changed since cases first started appearing up until now?
Yeah, well, we've learned so much about the disease. I mean, we're fortunate here in the Dakotas. It was in other parts of the world and then other parts of the United States before it really hit home here. And our physicians have just been tremendous in really just, improving the standard of care, understanding, working with, as a team with research and themselves in terms of coming up with the best ideas. So, I mean, really the change is that now, really if you really are severely affected, your time on a respirator, for example, is much shorter than it has been, much below the national average, and the stay in the hospital. And then the hospitalizations are going up. Obviously, don't get me wrong, that's a function of the spread of the virus, not our ability to care for individuals. So we're now at the point where really, if you're sick, then you really don't want to get COVID. But in the general sense, we can really handle this with a great portfolio of different trials that address this disease.
What kind of research still needs to be done to help understand how COVID-19 impacts our bodies?
Yeah, so we're standing here in Sanford Research right now, and we have a tremendous bench science capability where we're really looking at the cellular level, what this critter called COVID does in the cells, so we can get a better understanding. We hear so many different stories about how it affects different parts of the body and different individuals, and that's a function of the fact that this is a host response. We all respond differently to other viruses, so we're just learning more and more about that, so we can be more targeted and more predictive in terms of maybe you would have your lungs affected, maybe my kidneys might be affected. So it's called precision or personalized medicine.
Are you seeing more people become interested in medical research since the pandemic started?
I think, obviously the popular press has got a lot of opinions on science right now, and so I think that the general interest is much greater. What I'm really, so pleased with is any individual that's been through this is just contacting us and saying, what can I do? What can I do? One of the things that we've done is that we know that there's going to be a long-term effect in some people from having this virus. So the first thing we did is we created a registry. So every patient within our entire footprint, which is large, that's ever contracted COVID, we now are gathering that data so we can learn more about it, but also follow those individuals in terms of, if they're starting to develop other symptoms. And we have 20,000 people in that registry right now.
So vaccines are on everybody's minds right now. Are you guys working on vaccine research here?
Yeah. So we're not specifically developing a vaccine ourselves, but we are partnering with a number of different groups, so where we will be running the trials with respect to that. I think the interesting thing is, and I've talked about this, this is a time of war, essentially. So many different platforms are being developed to develop therapeutics and vaccines. So if you think about what a vaccine is, it's actually a therapeutic as well. as well as being a vaccine. If you give that vaccine very early on, it's going to help you raise the immune response. A vaccine is basically a way of boosting your immune system to attack and destroy that virus. So we're working with SAB here. We're the first in the nation to try their antibody therapy, which ultimately could be developed into a vaccine.
What do you think is the most important thing right now for the community to know regarding a vaccine?
Yeah. So there's a lot of information out there, a lot of misinformation out there. The vaccine will be available before the end of the year. The biggest challenge is that we have to understand how to distribute it and who to give it to first. Obviously, we've learned so much about who gets affected by this virus to them in most severely. We need to give it to those individuals. We need to be responsible with how we get that. And the other thing is we're running these trials here ourselves for a number of these vaccines, and there's going to be several that are available. But what I really want people to understand is coronavirus, we hear so much about it. It's really quite a dumb virus. It doesn't change. We hear it mutates. It's not like the flu, though. The flu changes constantly, and we have to change the vaccine every year. We're not going to have to do that for coronavirus. There'll be one vaccine times several developed by many other groups that will all work in some way.
And then how many COVID-19 trials are taking place currently here at Sanford?
Yeah, so we have 10 trials that are open right now, and as I say, that starts all the way from with our healthcare workers, where we're checking to see if they have been exposed by doing antibody testing, one of the things that we read a lot about, all the way to being an outpatient. If you first diagnosed, we have some treatments that we think that should slow the course of the disease or even prevent the development of more of the disease, all the way up to get the most sophisticated therapeutics right now. First in nation, for example, using stem cells, 1 of 12 sites using immunotherapeutics that if you are in the ICU.
Anything else that you think is important for the community to know?
I just want to re-emphasize that, I think I'm privileged to be running this organization's research. I really am. And I think this community should feel, as safe as anywhere else in the United States to have a health system that's so invested in research with respect to that.
All right. Thank you so much for joining us, Dr. Pierce. Still to come on our Health Beat special, COVID-19 research.
So I wanted to be able to contribute to future ways to help treat and possibly even cure the virus for other people.
We talk with one woman taking part in a COVID-19 registry to help researchers study the virus. We'll also show you how coronavirus testing may soon be evolving after the break.